Hi, I'm Ananth Vijendren. I'm a consultant ear, nose and throat surgeon here at One Hatfield Hospital, and I've got a special interest in otology, which is pertaining to the ears, in hearing and in balance. So there are three aspects to your ears. There's the outer ear, there's the middle ear, and there's the inner ear. And there could be different problems arising in each of these regions that can cause hearing loss. Broadly speaking, there are three different types of hearing loss. There's a conductive hearing loss, which is usually a problem with the outer and middle ear. There is a sensorineural hearing loss, which is predominantly a problem with the inner ear. And there can also be a mixed hearing loss, in which case there's a problem with all three aspects of your hearing. To talk briefly about the common causes of hearing loss, the vast majority of patients I see generally have issues with wax stuck in their ears, in which case removing the wax can help improve the hearing by a substantial margin. A lot of patients also have generalized deterioration of their hearing as they age, and this is termed presbycusis in medical terms. Other common causes of hearing loss include a lot of exposure to loud noise and also problems with the bones of hearing within the middle ear, either as a result of chronic ear infections or from pathology that causes the bones to become fixed as time goes on, and this is termed otosclerosis. Otosclerosis is a condition where the stapes bone, which is the innermost third bone, becomes stuck onto some of the structures in the middle ear, and resultantly it does not vibrate very much and causes a hearing loss. There are a couple of ways as to how we can treat or deal with otosclerosis. This can either be with using a hearing aid or by looking at an operation called stapedotomy. Commonest forms of hearing loss is termed presbycusis, which also means deterioration of the hearing in the inner parts of the ear as a result of aging processes. This can vary between different individuals and can even happen at different stages of life. The vast majority of presbycusis can be aided with hearing aids, and patients can have a very good quality of life. In some instances, the presbycusis is so far advanced that they may require surgical hearing implants, such as cochlear implants. The first thing to do when seeing a patient with hearing loss is to take a thorough history and to examine the ears, and a lot of patients would require an up-to-date hearing test and potentially a CT scan of their ears. Once we've taken into account all the factors, the commonest operations that we tend to offer here at One Hatfield include tympanoplasty or myringoplasty to help repair the eardrum. We can also perform ossiculoplasty to replace the bones of hearing, or a stapedotomy to replace the innermost bone if this is affected by a condition called otosclerosis. In some instances, patients may also benefit from implantable hearing devices, such as a bone-conducting hearing implant or a middle ear implant. One of the other operations that is commonly performed is grommet to drain fluid from the middle ear, and this can also help improve hearing. In children, most hearing loss is usually caused by either wax impaction, which we can remove via microsuction that's available here at One Hatfield. Some children also suffer from middle ear infection or otitis media with effusion, which is termed glue ear. Children with glue ear can respond to conservative measures such as using a balloon called otovent, or could benefit from a hearing aid, or may require the insertion of grommets, which are ventilation tubes used to drain the middle ear and to help equalize pressure with the external environment. If you're concerned about your hearing, I think the best thing to do is to book an appointment to come and see us here at One Hatfield. What we would normally do is to take a thorough history from you, examine your ears in great detail, usually using a microscope. We would then advocate having a hearing test done with or without a scan, either a CT or an MRI. And this gives us an overall picture of what is wrong with the hearing, and we can then give you a detailed plan of what we think is going on and how we can best help you with it. In a lot of occasions, the causes of hearing loss can be apparent on examination, which means that we can hopefully offer you something to be done there and there itself to help improve your hearing.